When a mom comes in, we triage them. And what that means is a nurse will come in and the mom will change and get in bed. And we put the mom on the monitor. And what that means is the baby's heart rate's evaluated, contractions are evaluated, blood pressure, heart rate, those kinds of things are evaluated. We gain some information based on prenatal care. Physicians usually fax over those prenatals, and so we have information on those moms already. Based on that, and then the kind of immediate physical assessment, we kind of judge where we're at, and then we call the physician. And then they determine on whether or not the mom is admitted. I think labor for a lot of people is contractions, but labor actually means cervical change. So you can be contracting for hours or days, and we call it prodromal labor, prodromal contractions, and those hurt and they're uncomfortable, but it's sort of preparing your body for the real labor process. Once you come in and you're admitted, then you are hopefully in that active labor phase where you're progressing and dilating. So if a mom comes in, we just sort of judge on what to do from there based on how she's feeling. For example, if she feels like I need something for pain, we'll usually do a cervical exam just to see if there's any progress. If they feel like, oh, I've got to push. Some of those symptoms are, I got to push, or maybe I feel like I have to have a bowel movement is another thing. They feel like they're going to have to do that. Then we'll check and see if the baby's close. Certainly if mom's getting to 8, 9 centimeters, we will go ahead and call the physician, let them know, and they'll come in for the pushing piece. Immediately after delivery, what we like to do at Mercy, what we think is best for the baby, is skin to skin. So what that means is we want the mom and the baby to do bonding time. So the baby immediately, as soon as it's delivered, usually the significant other will help with cutting the umbilical cord, and then the baby's placed on the mom's chest. And we love skin to skin for at least an hour. 2 or 3 is even better. And during that skin to skin time, the baby transitions, meaning just kind of gets used to being out in this environment and eventually decides, I might want to breastfeed. And we see a lot of babies just latch on by themselves. Sometimes they need a little nudge, but usually that skin to skin and that bonding time increases that breastfeeding. And they've done a lot of studies as well as that bonding time with the mom in the beginning is very helpful, even through age 5 with various things. So it's a really nice experience for mom. It's very hard for grandma because she wants to hold that baby, but we feel like it's really important that mom and baby spend that skin to skin bonding time.